our first guest in this series, and it's Dr. Tom Dawson PhD. Tom is well known for people, scientists and researchers in the hair and scalp. He was for a long, long time associated with Procter and Gamble in leading hair research into products and drugs, etc. But actually, he has over 30 years experience in drug discovery and has a big, big background in academic, commercial, and government research. As far as hair and scalp is concerned, he is currently the senior principal investigator at the Skin Research Institute in Singapore called A-STAR. He is affiliated professor at College of Pharmacology, the Department of Drug Discovery at the Medical University of South Carolina in the USA. So over to you, Iain. Yeah.
He's and for if you haven't seen it, Google Tom Dawson TED Talk. He's got the best TED Talk about hair ever. So I want to ask him about this. I've never met him before. He seems like a really cool guy. So I'm good.
What are we saying? He's big cheese.
He is a heavy hitter. So he is just joining our group now. There he is.
Hello, Tom.
Good morning. Hey, how are we doing?
All right, good.
Excellent.
Good morning to you guys as well.
Good morning. Is it morning where you are?
No, it's 5 p.m. here, so almost cocktail hour.
Oh. Singapore slang, I'm sure.
Yeah, sure. Something like that.
Yeah.
So thank you for joining us on our first Haircast. We really appreciate your time. We've just we haven't even bigged you up. We've just read what's on your CV, which is ridiculously impressive, and we want to thank you for joining us and to talk about hair, which I'm sure is one of your big passions.
It has been for quite a while.
So we gave you, and we're going to do this repeatedly with everybody who comes on, we're going to give you 11 questions that you can pick, about 4 of which, and then we've got some specific ones at the end. So so Bessam, do you want to start with the questions which Tom's picked?
Yeah. So we thought we'd make this a bit of fun and talk about you, the person, and your career, and then perhaps we could chat a little bit about subject of interest for all of us. So let's kick off and say the one thing that people you know, peers who perhaps not in our field, that you wish they knew about hair and scalp.
Oh, Bessam, this is a good one. I thought about this one a little bit beforehand, actually, and I think the thing that I would really like for people to understand is that hair is a lot more important to people than people think it is. Most people really don't change their hairstyle for their entire life. Maybe once or twice, maybe when they change from being a child to an adolescent, or when they go from being an adolescent, when they go from high school to college, because they know that that's going to be a big change. And that is not a little thing, and it manifests itself in a lot of different ways. Your hair is such a part of your personality, and if you don't ever drastically change your hairstyle, or if you don't ever have a hair issue, then you don't really realize exactly how important it is. And one of the ways that manifests itself is that people are very passionate about hair and hair care products, and people really want to know. People are educated, people are on the internet, you know, everybody understands a little bit about their hair and their hair regimen. Most people's pretty important to them. But when you really see it, is when you see people that have a hair issue, right? If somebody has what's called alopecia areata, and essentially a person can wake up in the morning and almost all their hair is falling out overnight for no apparent reason. And having talked to people with this disorder, they tell me that they look in the mirror and they don't recognize the person that's staring back at them. And that's a pretty big deal. People understand that. So it manifests itself in the passion that people have for hair, but it also manifests itself for people sort of in our profession. And one of the things I really learned quickly when I started working on hair is that when I first moved into the field, I learned from reading papers and talking to other people and sort of the consumer care side of the industry that there were a lot of measurements that were available today for hair loss treatment products, where what they really did was they measured a difference, but it wasn't a meaningful difference. And so while you had these measurements that could say, oh, this product gives you a little bit more hair, that wasn't meaningful to the consumer because they didn't notice it. And then it was because the measures were too sensitive. And what we learned was that that is not it at all. It's not that the measurements are not sensitive, and it's not that the measurements are too sensitive. It's that they're not sensitive enough. And that what it is that it's measuring the wrong thing. And so that changed everything sort of for the way we approached some of the things that we worked on, some of the stuff I've worked on in my life, and led to some of the things that have actually been, you know, a more of a noticeable difference and something that people more can care about. It was that when people brush their hair, when women look, you know, they're walking down the street and they look in the shot mirror and they see themselves, they touch it, people notice, and those measures are the most sensitive measures that there are for hair. And what people feel and think about their hair is way more sensitive than any sort of technical measure that I've seen people be able to put together today. So I just wish that more people in the profession could understand sort of the importance, not necessarily of things like number density counts of hairs per square centimeter, but understand sort of that really sharp emotional tie that people have with their hair, and help and get involved more in this. How do we actually measure and quantify what people feel and what they need?
That's really, really interesting. I found as speaking with patients, exactly the same thing. They tend to be very, very sensitive to their own amount of hair. Now, you can turn around to them and say, you have X amount of hairs per square centimeter, and then we'll put you onto a medication, and then in several months later, you'll have another X amount. But that really doesn't mean anything to them. All they want to know is, how does it feel to them? And yes, so it's
and how does it look to others? You know, that's a very big part of that equation as well. And it is interesting, and that's one of the ways that I first got involved with the people that work in hair restoration surgery and hair aesthetics in the clinics, like you guys do, is because there's a feeling for that and a passion for that that's very different from the people that are working in a big pharmaceutical company that are making products that are and measuring those differences by the number of hairs per square centimeter. We keep going back to that because it's a common one, but it in the group of hair restoration surgeons and in the group that I got involved with, there I found people that understood more of the subject and approached it more from the subject/patient perspective, and really found a depth of understanding of what the problem is that we don't really feel, you don't really get when you work sort of in a laboratory on isolated cells and things like that.
I think that's what we found is the value of collaboration between the clinical and the laboratory, like we've done in the past, is that everybody gets to understand the other's point of view. But back up what Iain was saying, yeah, it gets even more when you're actually planting hairs on people when hair didn't exist there before, and you get to understand that it's not about the amount of hair necessarily, but the way it sits, the way it curls, the way they're able to style it, and it's difficult to quantify exactly how people feel about how
I've been working on that I've been working on that hard now for nearly a decade, is trying to bridge. That's a huge chasm, right? That's a valley as you speak. And hopefully we'll make more progress on that soon, but
Yeah.
it is definitely something that I would love for more people in the field to be aware of and be willing to work on and address.
Excellent. So next question. How has a failure or apparent failure set you up for later success? Do you have a favorite failure?
Yeah, I do. This is a great one. I thought about this, and I've mentioned this story a couple times in the past, and it goes back to my work in dandruff. And so I got my PhD in cancer research, and then I left that and I went to pediatric genetics. And I did fairly well in graduate school and in my postdoctoral fellowship, and I moved to work for a big consumer care company. And I was all, I'm a geneticist, in early years of genetics and gene jock. And when I got there, the company wasn't really involved in that sort of work. And we figured out that this fungus malassezia was involved in dandruff. And I convinced my bosses, we had done probably a couple of years of work to show now everybody for the last 100 years had thought there was one species of this fungus named malassezia. And now we knew there's like at least 8 or 10, maybe more different species. And I could tell them apart using genetic tools. And so I spent a lot of time talking to my management, my supervisors. I was early in my career. I was confident. We were going to go out and we were going to discover the microorganism that causes dandruff, right? Everybody's got malassezia. Not everybody's got dandruff. There's going to be one specific causative bug X that causes dandruff. And convinced them, got a big slug of money, did a big clinical trial that involved a lot of people, a lot of time, and a lot of money. And we came back and we looked at what the difference was between people that have dandruff and people that don't have dandruff. What's the secret species that's only on the people that have dandruff and not on the people that don't have dandruff? And they were the same. It was exactly the same, right? And I was a young guy. I was all full of fire and brimstone. I had convinced my bosses this is the way to go, and it was an impressive crash and burn defeat on that data set. I mean, it really was. But at the same time, yes, it was a difficult time trying to figure that out. But what it did to set things up was to figure out, not just for what I do, but for what many people do in clinical research associated with fungi, with eukaryotic microbiology, is that a lot of times it's not the bug, it's you. And the microorganism can be pretty much the same, but you may get dandruff and you may not. And it's because of the way your body responds. And around the same time, another one of my colleagues was writing some papers about this and about what's called the damage response framework. And it's an attempt to describe and quantify sort of this complex phenomenon, which is, it's not always the microorganism or the disease agent that does the damage. Sometimes it's your body, and it's your body's response to that insult that causes the damage. And we're seeing this today, right? This is a COVID thing. A lot of the people that are really, really sick from COVID are really, really sick because their body's turned on itself. And this is common in viral and fungal infections, but not in bacterial infections. And so when people spend their time thinking about this sort of concept of we'll have a toxic bug, we'll kill the bug, the person will get better. That's probably not going to work with a lot of microbiology. And that's this whole concept of microbiome. It's not one bug, one disease. It's that you have a community, and it's a community of microorganisms, and it's our community of our human cells and the way they talk to each other. And that really set up what I think was a pretty major change in my thinking. As these things happen in science, sometimes the big discoveries take a while to sort of percolate down, right? Science can be a lot like a large ocean tanker moving straight through the sea. You turn the handle and it may take it several miles before it starts to shift direction. And even though we sort of started figuring that out probably between 2005 and 2010. Just now is it really starting to become more accepted that we need to get away from this idea of one bug, one disease, and start looking much more at sort of this holistic existence of all of the microbes and all of the microbiology and how they interact with our own cells and how that system functions. And that's what we've really been working on here in Singapore, probably for the last 3-4 years, is how to really characterize big populations of people where we look at the complexities of not just the microbiology, but also what's going on in that human individual too, and starting to pick apart those molecules where they talk to each other, because it's just more complicated than that. And that failure really led to sort of my epiphany that this is something that not just we working on dandruff need to work on, but we need to figure this out and how to start doing this more seriously for everybody.
How frustrated do you get with people that just come up to you with a product, or a company that just launches a product with hardly any research and goes, this will cure it, and you just, is it water over duck's back now, or is it?
It's a classic, and I see it all the time, right? And even now there's still a lot of publications come out in the literature. It's one of the things that is a positive about now being in a little bit more of a senior position, is that I see these things come in before they get published. And so I can reply in editors and reviewers' critiques, maybe you should think about this other thing. But, you can't control the system. And the frustration was worse at the beginning, because here I felt like we had this big discovery and it was obvious to us. But it just takes, but now I think I've sort of gotten more of a flavor for the fact that it's a good thing for some of these changes to be slow and steady, because otherwise you just whipsaw in every direction all the time, and you really need to build cases and you need to figure out ways to go. And so there's a reason why the system moves like it does. So the frustration on a day-to-day basis has gotten to be less over time.
So it was a successful failure, really.
Yes. Well, yeah. And that's what I try to teach everybody, right? I really have a lot of passion for students and young people. And that's why I'm familiar with that example and know it and can talk about it, is because I use it all the time, right? Whenever you have a failure in the lab, you've done what every scientist does. Way to go. That's it, right? That's what we do for a living.
Okay. So we move on to the next question, Iain.
Yes.
So actually, that brings us nicely to maybe another question here linked to what we just talked about. What advice would you give to a young smart, driven student about to enter this world from your experience? What should they take heed of, and what should they ignore?
Yeah, that's a good one, and I talk about that a lot too. And it is a good segue from that, because passion is key. You have to have it. I talk to a lot of people who are thinking about going to graduate school and getting a PhD or an MD or an advanced degree of any kind. And I always ask the same question. Why are you doing this? Why do you want to do this? And I get responses like, oh, well, I think I could get a better job. Oh, I've completed my undergrad and I'm not really sure what I'm going to do. If I get a PhD, then I'll be able to figure out stuff. And I'm like, nah, don't do it. You have got to have that passion. It's almost like to pursue a career in science, you almost need to love it so much that you can't not do it, right? You can't not do it. And I just have to do this. I've never wanted to do anything else. I've never done anything else, right? I've been a little scientist guy since I was blowing stuff up in my backyard when I was a little kid, right? And I tell people that, right? And sort of how do you get there? But at the same time, I encourage young people too to not that their passion not be too specific, right? If your passion is for working on how Wnt signaling displays the second cell division of placoid formation and hair follicle development. It's going to be hard, right? The passion needs to be for learning and for science and for improving people's lives. Because if you get too narrow too fast, you can end up being in a spot that's very hard to get out of, right? The analogy that I use is that sledding thing they do in the Olympics called luge, right? If you get in that little pipe too deep, too fast, it's going to be really hard to get out of it. And when you do get out of it, it'll be an accident.
So you came from a science background. You was blowing stuff up in your back garden. How did you get into hair science? What was it about hair?
That goes back to this question of with young people, right? A lot of people say, how did you get where you are today? What did you do, right? And I will be the first to admit, and my wife will be the second to admit that, right? It's a long, hard road, right? Getting a PhD, and you spend a lot of time in the lab. You're there all hours and stuff. But in a lot of ways, I sort of have done stuff that I thought was cool and fun with people that I like. And that has led down these paths. As I said, I started out working in chemistry and vitamin C analogs for cancer. I moved to organ transplantation and biophysics. I did cancer genetics, human pediatric genetics. But realistically, when I moved to consumer care, I took the job because I wasn't really that happy with what I was doing, and I was looking for something different. And the company said, we would like for somebody to come and work on hair growth. They said, we're interested. We have a joint venture with Pfizer. We're going to work on delivery mechanisms for minoxidil and figure out how to make hair grow better. And I was like, all right, that sounds like fun to me. But there was like a 5-month gap between when I got that offer and that plan and when I actually got hired. And by the time I got hired, that project had been canceled. All the employees had been moved off to new things, and there was no one left working on that. So, the answer I got was, well, we have this brand, Head and Shoulders, and it's getting ready to come under competitive threat by a drug product that's moving from prescription to over the counter. So we need to figure out how to make this product better. So we need you to work on dandruff. And it was like, hey, all right, I can figure that out, right? And so started working on mycology and fungus, surrounded myself with people that I thought were smart, that I liked, that knew more about it than I did, moved ahead. And then a few years later, I got a call one day and it was like, well, great job on that Head and Shoulder stuff. Thanks very much. We need you to do the same thing for Pantene. And I was like, I just became a cutaneous microbiologist. Now I need to become an expert in signal transduction. And they were like, shampoo's shampoo. You'll figure it out. And it was kind of that way, right? It was the same thing. I found people that knew way more about the product than I did. And I looked for stuff that looked like it was going to be interesting, different, new, with people that I liked, that knew what to do, knew how to do stuff and learned along the way. And then really the passion for the hair care stuff came from talking to people who had hair care issues. So as we started working with consumers, and in this case, it was particularly women that had thin hair, and we started working with them and doing trials on products to see if they would work. And the passion that they felt, the depth of feeling that they had for the hair loss they were seeking and how it impacted their life, their job, their marriage, their relationships. It was like, this is way more than just working on styling products, right? And so it was easy to find a passion once I sort of had those interactions with the people, with the subjects, right? So the actual patients, that's where the passion comes from. And I'd had that same experience with dandruff before. And so I do tell people, get out there and interact with the people that are the ones you're trying to work on.
It's amazing. It's a really interesting story, and it resonates with a lot of people that they just fell into it and then they never got out of hair because it is just such an interesting subject. What does amaze me is you're probably one of the most educated people I've ever met, and you've dealt with Pantene and Head and Shoulders, and those are the two products which, at hairdresser level, they absolutely rally against because they go, "Oh, it's terrible stuff. It's horrible. Use this stuff which is on my shelf." And you've just actually put into context how much effort goes into those products.
Oh, yeah. So people ask me that a lot, right? You know, what should I use, right? You've got hair, you've got tons of hair. What should I be using? And you know, a lot of times when you have a big dog on the block, right? Somebody that's like a Procter and Gamble, a Unilever, a L'Oreal, they're going to put a lot of effort into making a quality product. A lot, way more than a mom and pop group can do. Right now, there's always a chance that a mom and pop group has discovered the miracle pixie dust. There is that chance, but you know, there's a lot of products that have claimed miracle pixie dust over the last century and really haven't played out very well. Not a lot of them do. You know, some of them are good products and work well and help. But if you really, you know, are looking for something, you know, what's the base care line for hair? You don't, you know. Yes, there are good products, and yes, there are expensive salon brands that are worth the money. There are. But people ask me what I use, you know, and I say Dove. It's great. They have a submicron silicone deposition coacervate, which just happens to leave the right amount of stuff on my hair. You know, and it's different for everybody, but you know, that kind of stuff is important.
And Dove,
that's made by the other guys, right?
Yeah, that's the other guys, absolutely.
Yeah. and if P&G or the other guys are listening, we are looking for sponsors. So by all means. So Bessam, you've got some specific questions for Tom.
Yeah, actually, from what you were just saying, again, nicely doves into what I'm going to ask you next. So we talked about that we all have these organisms on our head, the malassezia, the microbiome. But the difference could be in us, in the environment, and how we react to it. So, you know, I do hair transplant surgery day in, day out, and sometimes people react differently in their recovery. The scalp sometimes can go a bit redder, can react. You can almost think that's an infection, but it isn't. It's just a extensive redness or sensitivity. So, do you think somebody having surgery and they happen to be maybe a susceptible type person makes them even more sensitive to the existing fungus on their head, and therefore almost get an exaggerated dermatitis or seborrheic kind of reaction? And if so, is it wise then to maybe use some of the products we talked about as a precautionary measure before and after?
Yeah, and you know, it's a great question, and it's got a lot of layers, right? So absolutely, everybody's different. Absolutely, everybody has sort of a different microbiology, and everybody reacts their own way to their own microbiology. But these fungi, malassezia, they live on everybody's skin, but they have unquestionably, they have a potential role in pathogenesis in a lot of different ways, right? They can, you know, in people with a deficient immune system, they can be a real problem even for septic infections. But they can also cause Malassezia folliculitis, which is a hair and scalp person I'm sure you've seen. And that's where, you know, Malassezia are normally only north of the sebaceous gland. Right, so they only go 200-300 microns down in the follicle. They're pretty much exclusively after the sebaceous gland is intersected with the follicle, and from there up, where there's enough space between the inner root sheath and the cuticle, and there's enough oil and water in there, protein for them to have a nice, warm, snuggly, well-fed place to live. Below that, I don't really think normally there's enough oxygen, there's enough space. It's just not a good habitat. But in some people, they get down there and they live and they cause this folliculitis, which can be a real problem, very difficult to get rid of. Also, malassezia secrete a lot of things that are irritating. They generate a lot of unsaturated and polyunsaturated fatty acids that can penetrate the skin and cause just a contact irritant dermatitis type effect, right? That redness you talk about. Mm-hmm. And that may be at the root of dandruff in people that are sufferers. And when you're doing a hair restoration surgery, you are creating a bunch of tiny wounds in the scalp. And then when you take that follicle, right, you've made your incision and you're taking the follicle and you're inserting it in there. That's been out and around, and now it's going along the skin and down in. It seems possible to me that you could carry stuff down as it goes in. Mm. So I've thought about that a lot, and I'm not a physician and I'm not a hair restoration surgeon, so I'm loath to make hardcore treatment recommendations without a lot of clinical work, right? However, it seems like there would be some wisdom in using something to help manage that microbiology before you went in. And I've had these conversations one-on-one with a few other people in the field, to sort of say, this I think is worth trying, right? When I worked for the company, you could never recommend this or never talk about this because of, just it's off message. But some of these products, and in particular the selenium sulfide containing products, right? They're not all that pleasant to use, so they're not usually real common for people to use on a daily basis. But they do an extraordinary job of being able to simplify that fungal microflora on the scalp. Right. Also, zinc and zinc containing products, it's not just advertising, it's good for your skin, right? I mean, we've done that. Everybody's used zinc oxide for diaper rash on their kids. I mean, it does something good. So it does feel to me like there would be the potential for some pre-treatment. Now, the flip side of that is, if you remove the malassezia, do you change the niche, the habitat in such a way that you could have a negative impact on some sort of bacterial overgrowth? And I don't know the answer to that. All I know is that it doesn't seem to have ever happened in the past. And these ZPT containing products have been on the market for 60 years now. So I don't know, right? When my mom had knee surgery, they had she sterilized her whole leg with betadine for a week before she went in. But for the hair restoration surgery, really, we don't do much of that, right? It's a sort of surface type change, but I would love to see somebody try that and see if that made a difference and whether they had a change in folliculitis and a change in inflammation to, sort of have subjects pre-treat for a week with some sort of an antifungal product. And then potentially, I know with the recovery phase, you need to be pretty careful for the first couple of weeks. But if when people came back, maybe there was a way to be able to start with some of these shampoos, once the incisions have healed and you have closure. So I would love to know whether that would work. It's just an idea that's been bouncing around in my head for a while. I've talked about it with a few people that are in the field, and I would love to see whether it would work or not.
Yeah, it seemed to make sense, although there's been no studies and it's difficult to quantify, but just seems like worth doing a long-term sort of look at it and see if the numbers.
And I think that's the only way you could really do it would be to have a few people sort of, start because it's a rare enough event, right? These sort of folliculitis and inflammatory responses that it'd be very difficult to just recruit. The clinical study would be ginormous, right? To get enough people. But if you just had a group of surgeons that were interested in trying it and starting to document the incidence of these things, in a few years, you would have enough cases where you would start to understand whether there was a change or not.
Great.
So I've got a final question for you, Tom, and it's one close to my heart because I do suffer from seborrheic dermatitis myself. So chronic flaking conditions. I've suffered from this since I was 16. And it's always been the same products, antifungals, ZPT, octapyrox, those types of things. But is there any new information that is coming to light that you know that we are treating these in too much of a simplified way? Is there anything which is going to sort of change the way that we look at chronic scalp conditions such as dandruff and sebderm?
Yeah, I mean, it's a great question, and it's a question close to me and my experience because it's what I do for a living, right? I've spent the last, 22, 23 years trying to figure out how to take those kind of products and make them better, right? So I worked for a company that sold a product that contained ZPT. So my job wasn't to replace that material or cure dandruff with a different mechanism. It was to figure out how to make that work better. But what we did learn is that there's a lot of interaction, as sort of talked about this before, there's a lot of interaction between the microbes and each other and the microbes and the human. And what we've started to disentangle in our group, and we have a couple papers that should be coming out this year, I hope, understanding this crosstalk where we're figuring out the specific molecules that the fungi use to communicate with the host. Our hypothesis for a while has been that one of the things Malassezia are able to do is upregulate sebum secretion. Makes perfect sense, right? It's their food source. If it was a plant fungus on a plant, they would tell that plant to start making their food and it would do it. I don't see any reason why that would not be going on in us. So for today, I think they're really, we don't know of anything that's going to balance the microbiome in a way that it's healthier without killing the fungi. But I think we're on the cusp, maybe in the next 5 years, of really figuring out ways where we could make that change. And then there's a gap between when you have understanding and when you have products. So maybe in the next 5 to 10 years, we would really start to be able to feel the ability to do that. Are there things that we can feed the microbiome that's on our scalp in a way that it no longer secretes the toxic metabolites, right? Almost certainly the flaking is a secondary event, right? They want something. These fungi want something. They want a home. They want a place to live. The flaking is just an unwanted side effect as any other pathogenesis. So if we could figure out maybe a way to be able to give the bug something that it needs without having to secrete those toxic metabolites or those enzymes that interact with us in a way to do that, that would be great. And I think we might be able to do that. Or if we could intercept that signaling. One of the things we believe is that these microorganisms, it's a balance, right? So it's like a teeter-totter, inflammation, growth, healthy growth. Because you have to have healthy growth. And if you have too much, you get into this inflammatory phenotype. Could we figure out ways to be able to apply some of these signaling molecules to get the skin to believe that it's not necessarily being invaded, or it doesn't have to produce this inflammatory response? Really, this microorganism on your skin is a normal part of your microflora and it's perfectly healthy for it to be there. Stop, just calm down. Don't react, don't overreact with this inflammatory response that leads to the flaking. And I think there'd be a lot of benefits to that, right? Because we'd be back to a more sort of holistic cycle where we have a healthy homeostasis. That's a word we use a lot in our program today, is how can we rebalance the system to restore a healthy homeostasis that we had before we got dandruff. Nobody has dandruff when they're a child. Very few people have it before puberty. How do we return to the healthy homeostasis for people that are not dandruff sufferers without necessarily using antifungal chemistry? I'd love to do it. I'm working on it hard. I just don't know that we're there yet.
Perfect. Yeah. That is really, really interesting. So thank you so much for joining us. We really appreciate your time. I have underlined several times, ask him to talk. So at some point, would you please come and do a talk with the ITC Congress, because I could listen to you all day.
I would love to do that. I mean, I love doing that. So, you know, I'm a big believer in education and collaboration. And you know, one of the questions that you guys didn't really get to ask is what's one of the most important things that you've always done that you think is important to your success? And one of them is finding people, smart people that you like, and working with them, right? Because that's just the way it works, right? I met Bessam and Nilifer years ago, and right away it was like, all right, here are smart people that I like. We can learn from each other, right? And so doing that, the more you do that, the happier you'll be and the more productive you'll be as a scientist. So I love going to meetings and meeting people and talking about doing different stuff.
Perfect. But Sam, do you know any smart people that I can befriend?
I can smarten you up, Iain. Don't worry.
Yes, great. And we just met today. I'm sure it'll work out for us, Iain.
Believe me, Tom, you've got a fan. I mean, we haven't spoken about your TED Talk, but we'll put the TED Talk in the links that we have to this. It'll be on our YouTube thing. And it was just, it's a stunning talk. And I do actually direct my patients to look at that because people are very embarrassed about their hair loss issues. And also it's a psychological thing, thinking that they shouldn't be as worried about it as they should. So they feel guilt about hair loss as well. And they come and going, I know it's not a big deal, and it's like, well, yes, it is. And this is the reason why you've got that juxtaposition in your head. So just listening to you is just amazing. But stay in the waiting room. We'll say our thank yous and goodbyes, but so we'll just pretend sign off. So we'll just speak to you in a second. So just let me just do that. So I think that was a good first start, Sam. Thank you for co-hosting and everything like that. We'll be back probably next month with another speaker, and yeah, we'll just see how this goes. So if anybody who wishes to join us for the ITC subscription talks, just go to trichologycongress.com, hit the subscribe button, and then you get our monthly webinars, which hopefully Tom is going to be part of very shortly. And also we'll be releasing information about the congresses that we're going to do this year as well shortly. So thank you very much, and we'll speak soon.